meeting of the board to order. Will the secretary please call the roll?
Director Curry,
Present.
Vice Chair Deere,
Deere is here.
Director Garza,
Present.
Director Guggenheim,
Present.
Director Guggenheim,
Present.
Director Harrington,
Present.
Director Kim is absent. Director Ketting,
Present.
Director Munar,
Present.
Director Prendergast,
Present.
Director Ryder,
Ryder's here.
Director Story,
Present.
and Chair Taylor.
Present.
You have a quorum.
Thank you. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. To streamline, we'll combine the action items into a combined motion. Meetings of the CCH board and its committees will be held remotely until otherwise noticed due to the determination that a public health emergency exists. The next regular meeting of the board will be held Friday, July 29th at 9 a.m. The first item on today's agenda is employee recognition, which will be reviewed by Mr. Rocha or his designee. I believe it's Alex this week from Communications.
Actually, I think I'll be recognized.
You're going to do it?
Director.
Okay, perfect. There you go.
Wonderful. So with us today, we have a few employees who are logged on to the session and want to be able to recognize a few folks with us here today. So first, we wanted to start that Stroger Hospital received national acknowledgement from the American Heart Association for earning the Get With the Guidelines Stroke Silver Plus Award. The award was in recognition for the commitment of Stroger Hospital to ensuring that stroke patients receive the most appropriate treatment according to nationally recognized research-based guidelines. The hospital was also awarded the Target Type 2 Diabetes Honor Roll, which ensures that patients with type 2 diabetes receive the most up-to-date evidence-based care when hospitalized with cardiovascular disease and stroke. We want to truly commend our overall team with a special recognition to Dr. Lakshmi Warrior, the chair of neurology, Catherine Dudzik, the stroke coordinator, and the entire neurology team for their work in achieving this recognition, and most importantly, for achieving these elements that ensure patient safety and appropriate care for our community. Cook County Health was also selected as one of 5 winners of the innovation session at the National Stigma of Addiction Summit. The showcase work, led by Dr. Julie Nowinski Konchak and Sarah Elder, Dr. Jeff Watts, Dr. Keiki Hanami, and Dr. Bill Trick, is a partnership between the CCH Substance Use Disorder Program and our Business Intelligence Unit to utilize patient-reported outcomes to reduce stigma in addiction treatment. Additional co-chairs included Brittany Green, our recovery coach in the SUD program, and Dr. Clay Caitlin and Ravi Madaya of Business Intelligence. These teams have done incredible work, and as we know, that reducing the stigma associated with mental health or seeking assistance and addiction is one of the most important elements that we can do to ensure that care is available and achieved through our community. Please join me and the entire Cook County Health family in recognizing these standout employees for this board. Also want to start with a quick announcement that we received this morning and that we wanted to share, that our county care program, along with its innovation that is a joint partnership between county care and Cook County Health and our flexible housing pool, was invited to participate in the Institute for Medicaid Innovation. That is a Medicaid managed care pandemic pilot, which examines the incredible innovation that Medicaid health plans are doing in response to the pandemic to address social determinants and improve health equity. This was done with support from the Episcopal Health Foundation and the Robert Wood Johnson Foundation for creating this initiative. It is being conducted as a national best pilot model to be able to do an environmental scan, culminating in the creation of comprehensive compendium of 33 innovative initiatives. County Care's partner partnership with our flexible housing pool is one of those initiatives. We are so excited that our county care team, the work that the Cook County Health team has been doing to create new avenues and opportunities for patients to seek help, assistance, and most of all, treatment, and helping to address social risk factors and social concerns as they're able to seek healthcare is being recognized for its ingenuity and its innovation, and in helping to reach more assistance to patients so that every patient can live their healthiest life. So please join me in congratulating our county care team along with our housing team at Cook County Health for their extraordinary work in helping to close these gaps in social risk factors and better bring more healing solutions to our patients, community, and members. Congratulations to our team. That concludes our employee recognition for this meeting, Chair.
Thank you very, very, very much, Chair. Well done to all, Mr. Rocha. The next item is public testimony. Madam Secretary, do we have any written testimony that was submitted to be read into the record?
We do not receive any.
Thank you. We're going to take the report from the CEO out of order due to some timing challenges. So Mr. Rocha, will you please proceed to present your report?
Sure. Good morning again to members of the board. I'm happy to bring forward my report in its entirety. I will have some highlights that will be shared with you today. First, I want to share that Cook County Health participated in the City of Chicago's full-scale disaster drill on June 1st. The drill tested the hospital community's ability across the entire city to respond to a surge of patients that had results of altercations due to heat in a busy Chicago weekend with large events that were underway. Both Stroger and Providence hospitals received patients during the drill. The incident command system was activated, and our team responded very well, and we identified several opportunities for us to be able to recognize and participate in this drill. And so we wanted to say that here at Cook County Health, we learned a lot. We are ready. We are able to identify some opportunities to further improve our response plan, but do want to recognize our teams across both Stroger and Providence Hospital who displayed incredible readiness to be able to be agile and to be able to meet the demands of the patients. It showed what we're most proud of, a integrated and comprehensive response across all of our care divisions at Cook County Health in meeting this response. And again, this was a simulated event that would be able to show what a hospital system would do. And this activated several hospitals throughout Chicago to be able to demonstrate our ability to meet with care for patients should we ever experience a large-scale events throughout our community. And so I want to thank our team for being ready. And again, we had several highlights that showed great work and partnership and several areas of opportunity that we will be correcting. More details is in your report. Also, we wanted to highlight that one of our most important things that we can do is prevention. And so as we all know that we have seen a rise of gun violence that has been happening across our country. Being able to put things in place that prevent these elements from happening across the country is one of our highest priorities. So we were very happy to join President Kirkwinkle and Senator Durbin at a press conference to commemorate our Wear Orange Day celebration. They discussed the impact of gun violence and the need for common sense gun safety reforms, noting that guns are now the leading cause of death for children, surpassing motor vehicle deaths. And that is a very special milestone that we want to make sure that's recognized, not special in a positive way, but special in need for us to take action. That for the first time, the number one leading cause of death in children is that they will be subject to gun violence. And so because of this, we held an event. We were able to bring attention to the issue. We had our trauma surgeons talk about what they were able to see and how this is impacting our community. Along those initiatives, we also had a Stop the Bleed event where we were able to train several community members. Being able to know how to stop a bleed just in time is one of the things that we can do to have individuals be able to respond in those types of events. We hope that they never happen, but having the skill to know how to stop a bleed is the thing that can be able to determine life and death in a patient and give them just that extra time to be able to get to a hospital and have their life saved. So we were able to train several nonprofit organizations, responder organizations, some of our elected officials, and we will continue to train individuals and stop the bleed through our community. As of June 17th, we also want to highlight that there were 15 confirmed cases of monkeypox in the state of Illinois. Several more are under investigation. Cook County Health and the Cook County Department of Public Health are monitoring the situation, and we are putting plans in place to be able to respond should we see greater outbreaks of cases. At this time, authorities do not believe that monkeypox will spread widely throughout the country. The virus has historically not been fatal in the U.S. Cook County Health has created a monkeypox resource page and a rapid response team who is meeting continually to evaluate these initiatives. That team is being led by Dr. Wellbell, who is on the phone with me. And I'm going to take a quick pause to recognize Dr. Wellbell. Dr. Wellbell, do you want to share any information or any updates on our monkeypox response?
Thank you very much, Mr. Rocha. First of all, I just want to tell the board that I feel confident that we are prepared to recognize any patient who walks into any of our facilities who may potentially have monkeypox. And we are prepared to understand how we need to diagnose such a patient and how to treat such a patient. As Mr. Rocha said, we have put up the communications team here promptly put up a monkeypox site on our intranet, and that has been completely populated with all of the resources that people need to know, and it gets updated on an almost daily basis. I'm happy to answer any questions.
Sure. Any questions before we go forward, in particular to monkeypox from the board?
When was the last confirmed case?
The last confirmed case was a number of days ago, but there are a number of cases that are pending confirmation from CDC. We actually have seen a patient with suspected monkeypox. The testing has been done and we're waiting for confirmation.
Okay, thank you.
What are the recommendations on vaccination for monkeypox? I was listening to something this morning that there's been interest in vaccination out in New York City.
Yeah, New York City has set up a site at a very large STI facility, and we will be setting up sites in Chicago as well. We will be participating in that. I actually have a call right after this on how to receive vaccine. So we will be working with, we are working with the health department as well as UIC and Rush to receive vaccine. Who's going to get vaccinated? So people with what's called a high risk exposure, not that the person is at high risk, but the exposure is at high risk. And there's a definition for that high risk exposure. They can receive post-exposure prophylaxis. And then there's going to be something called extended PrEP or pre-exposure vaccination to groups who are also deemed to be at high risk for acquiring or being exposed to monkeypox. But I do have to say that the amount of vaccine currently is very limited. So it is all being vetted through individuals like ourselves. We'll be part of that. CDPH, IDPH, and the CDC.
Thank you.
Yes. But what we're doing is a similar concept to what New York is doing. Other questions?
Wonderful. I see one more, I think.
This is Director Harrington. The only thing that I'm somewhat concerned about is our messaging moving forward around monkeypox, particularly with vaccine being available and being abundantly clear about who's eligible and what how likely it is that other people will get monkeypox. So our communication around what we're doing, public communication around what we're doing is going to be very important. And it has to be very clear and unambiguous.
Yeah. Thank you. Thank you. I completely agree. This isn't something that we anticipate is going to be, you know, a massive, it's spreading massively and unpredictably. It is fairly predictable. But I do agree, the messaging has to be very clear, particularly because there's limited vaccine and who would be appropriate to get the vaccine. And also, it is the same vaccine that is used for smallpox, but it's not the same vaccine that we used to use, which was use the scarification technique. So it's a much safer vaccine. And I think that we need to, that message also needs to be delivered.
Any other questions? All right, then we'll go back to quickly finish our report, and then we'll submit the entirety for the record. We did want to recognize that, again, we are committed to closing the gaps in our healthcare delivery system in being able to mitigate social risk factors of our patients. Part of that starts with education, and so we're happy to recognize that Cook County Health's Chief Equity and Inclusion Officer, Shannon Andrews, spoke at the Health News Illinois panel that was closing on health equity gaps and discussed Cook County Health's commitment and legacy to be able to address this in our new programs. Also want to recognize that our My Shot Cook County and County Cares We've Got You Covered won gold awards in the 2022 Astor Awards for the total advertising campaign category. The Astor Awards is one of the most inclusive groups of categories in healthcare advertising, dedicated to recognizing the most talented healthcare or marketing professionals and outstanding events and marketing communications. And this to us is important because one of the things that we are recognizing is our ability to communicate to our patients outside of the four walls of the patient room or the hospital, and being able to communicate in vital information, whether it's about campaigns for vaccines or other information that we can share. The road to destigmatizing concerns on healthcare is through education. And so being able to have our marketing campaigns that are geared towards public education is one of our milestones in ensuring that everyone gets this information in every avenue possible, whether it be through a streaming service on the internet, while watching Hulu or YouTube or any which way possible. We want to make every avenue an avenue in which you can live your healthiest life. And so do want to recognize our team for taking this approach. And honestly, I will conclude with our COVID-19 update. Chicago and Cook County are in the medium transmission. Hospitalizations remain relatively low, and Cook County Health will be providing vaccine to children under 5 next week at all sites. Appointments will be required and can be made by going to vaccine.cookcountyil.gov. Both CCH and CCDPH continue to offer vaccines, including booster shots, to the community. A full list of locations, times can be located at the website, vaccine.cookcountyil.gov. And will be available on the site. And also just a quick notice to the board, and we'll be providing more information. The Supreme Court has released its Roe v. Wade decision a few moments ago.
Which is incredibly important, but I want to go back. Can I ask a quick question about vaccine on the COVID
Please.
side?
Absolutely.
Yeah. So I know that as our community numbers have improved, at least that's what I recall. But it seems to, as one person who has been impacted by this, and also talking to other folks, seems that the people who are in the age group that are less than 50, who are now more than 6 months out from their first booster shot, do we know when, do we have any sense of when people under the age of 50 will be eligible for their second booster? Because it seems this is all anecdotal, right? I don't have any hard figures. I just have personal experience. Is that there's been community spread amongst those of us in our 30s and 40s. Like, I mean, I'm dealing. I was positive for COVID over a week ago. And my booster shot was in November. So I'm wondering, do we know when the CDC's gonna change their guidance on that?
So I know that the CDC is reviewing that information. We have not received any information. We do tell all patients, if you are immunocompromised or you have any concerns, to please visit with your physician and to make that decision. if you feel that you have an increased need. The vaccines, are doing their part in the fact that even though people may be getting COVID cases, our mortality rates are at record low. Our hospitalizations
Oh,
are at record low. They have, it wasn't supposed to be completely
Absolutely.
eradicated. But
Yeah,
I definitely understand.
absolutely.
Yeah.
I went through the experience. Yeah, I was just going to offer that I went through the experience where I was with someone who was just over 50, had their second booster shot. Someone who was under 50 hadn't had their booster shot, their second booster shot. One got COVID, the other one didn't, from being exposed to the same person. So I was just, and for sure, believe me, and the availability of Paxlovid and everything else, I think we're in a great place. I'm just curious because I feel, I don't know how much COVID vaccines readily available, but the more we can stomp out the spread of it, the better. Understood that we're never going to eradicate it at this point.
No, absolutely. And I know that the CDC is evaluating it very closely to see when we can come out with those recommendations. I'm going to take a quick pause real quickly. Dr. Webel, is there any information that you would like to share on any updates on the availability? I know you're tracking this very, very closely. Is there anything that you would like to share on when this could be available, or what patients can do if they feel that they would like to be able to get the additional dose?
Thank you. Exactly what you said, Mr. Rocha. It's still recommended for 50 and older, and those under 50 with comorbid illnesses, particularly being immunocompromised. And Director Ryder, I hear what you're saying. The vaccines were not really created to prevent infection, which sounds crazy, but to prevent risk of hospitalization and death and serious illness, which they're doing a good job of doing. And so there's a lot of debate about whether we need to do ongoing boosters and how many boosters we can have. And again, the booster that we're using right now is still the first vaccine that we all ever received. So it's still geared towards the Wuhan virus. And so the feeling is that we should, when we're going to get boosted, it should be towards the Omicron variant. And that there presumably is going to be an Omicron variant booster available in the fall, potentially also combined with flu vaccine. So that is the hope. And I believe that is when a booster will be offered to most people.
Great. This is good information, and I'm not. The reason why I'm asking, I mean, for me at this point, I wouldn't be eligible for a booster for a while, but I was just curious because I'm like I said, anecdotally, it seems to be going through pretty quickly amongst people who've only had one booster shot at this point. And like you said, I completely understood. This was the vaccine's is there to help prevent serious illness, and it's definitely doing its job.
Right. And as you know, plenty of people who are fully boosted are also getting the disease, but not getting severely ill. So, and I understand your point as well. So it's I am looking forward to when we have the Omicron booster. Just of note, we will have, B45. The next variant is that is in the city. And if you look at the CDC website, rates are increasing, just like we saw in South Africa and most of Europe. Some countries worse than others, like Portugal and so forth. So there will be yet another variant. It is yet a little more infectious than the B28.12.1. which seems crazy. I don't know how they can become any more infectious than they already are, but it is. And in people who have had either BA1, BA2, or BA2.12.1 are not immune to getting B45. And I'm just saying that because we still all need to take precautions. to prevent ourselves and others from getting ill.
Well, and I would remind folks too that after you've had a positive COVID case, if you're within a week or so and you develop symptoms again, and you write it off as allergies or something similar, you should still get tested, because it's possible that you could be having what they call a rebound case, or never actually recovered. So people have to be vigilant about that, and not be cavalier by the, with the strict guidelines of 5 days. So
Yeah, I completely agree. We are seeing a lot of cases of rebound, particularly for patients who take antivirals. So Paxlovid being the most common that's being used. It's occurs about 2 to 8 days after you're done with your therapy. And unfortunately, it's not getting reported enough. So we don't know how many people actually have it, but anecdotally, we're seeing a fair amount of it, and somebody is infectious when they have rebound. So again, appreciate your comment, increase awareness.
you can put me down as one of those rebound cases.
Okay. Yeah.
Mi-
Sorry
Mr.
to
Chair,
hear
I have
that.
a question. Mr. Chair, I have a question
Go
along
ahead.
those lines too. So in line with what Chair Ryder mentioned, originally, when the vaccines first came out, there was education out there like, this is what you need to take to prevent illness, right? And so it continues on to be that a lot of people still believe that if you got the vaccine, you can't get COVID. And so I think that there has to be more of a campaign of education so that individuals understand you need to be vaccinated, and it prevents serious illness. That does not mean that you cannot get COVID, but if you so happen to get COVID or reduces your chances, then it tends to prevent serious illness. Would that be a fair assumption of the timeline?
Yeah, absolutely.
Yeah, no. Okay. And by the way, since this is a healthcare setting, I just saw on my phone the Supreme Court just overturned Roe versus Wade. So, which is unfortunate for all of us.
I do want to thank Dr. Ryder for bringing that question forward, because we've had a lot of these questions come up. So thank you for the opportunity to share the information. And we will make sure that we put that additional information on our vaccine website and myshotcookcounty.org, so that we can make sure that we are able to give this information. Because I know there's a lot of questions about individuals and how why people are getting COVID, why not, how's it working, what does this mean, am I at risk? So we will send out some additional information on that as well. And so
Israel, just not to prolong this, the one thing, and this is about not what we're communicating, but generally, and I know that it's still in the early stages, is that whenever we have something that we could educate people about rebound COVID, I think that would be helpful, because it completely changes someone's assumed infectious in isolation period from what people generally know. So I think that, all that, and the information out there is very sparse, and it's more coming out of studies that are getting published on journal websites. So some CDC information, but I don't know that it's clear enough for the general public generally.
Yeah, I agree. I think to summarize for those that are listening, and definitely Dr. Wellbrook can correct, and then I'll be recognizing a new member of our public health team who can add a little bit in that shortly. But what I would say is that what we should know, that your best thing to do if you want to prevent any serious complications is to get vaccinated. If you have not been, to take all the vaccine doses that you're eligible for. If you are immunocompromised, talk to your physician. If you need to take additional boosters and are under the age of 50, we also should continue to take the protocols that we have in hand, which is to watch our distance, wash our hands, consider how we wear masks in indoor spaces if we feel that we're at risk or we come into contact information. Watch for symptoms and be able to take those precautions if you feel that at any point you have any symptoms or have been near someone who has COVID. You definitely should be able to take the precautions of wearing a mask, washing your distance, avoiding contact if possible until you know your status. Know your status. They're home tests. You can take them at any time, and make sure that you're taking every precaution possible to keep everyone safe. Even though you are vaccinated, you still may become COVID positive because, as Dr. Welba informed, there are different variants that react differently to the original vaccine. However, the vaccines have proven to help keep everyone from getting some of the most severe issues that could occur with COVID. And so that's why we're seeing record low hospitalizations and mortalities, but we are seeing an increase in infections. And so we want to make sure that the way that we continue to do our very best to contain COVID is to know your status, keep your, if possible, know what you're doing, get vaccinated, and follow the precautions if you have any concerns or if you have any symptoms, which is wash your hands, watch your distance, and wear a mask, and make sure that you know your status. And I think that's what we can summarize, what we can do right now, and hopefully we'll even have more information in the very near future. And with that, I'm going to conclude by welcoming a new member of our public health team. Dr. Lamar Hasbrook has been officially appointed as our new Chief Operating Officer of the Public Health, the Cook County Public Health Department. He comes to us as a former Illinois resident and a resident of the world with very varied experience, from working at the CDC to the American Medical Association to working throughout the world and throughout Cook County, the state, and our country internationally. Brings a wealth of experience in how to be able to manage pandemics, illness, and most importantly, has a very strong steadfast commitment to reducing disparities in healthcare and ensuring that everyone has the information they need to live their best life. And so with that, I would like to officially welcome and present to the board in my closing comments today, Dr. Lamar Hasbrook. So Dr. Hasbrook, we want to introduce yourself to the board and welcome to Cook County Health.
Thank you, Israel, and good morning to the board. First of all, it's great to be back home. I'm calling this my home now. This is my third tour here in Chicago, and given that I've been kind of a resident of the world, this is as close to home as anything I have nowadays. So just looking forward to meeting you all and rekindling some friendships with some of you all that I know and have known in previous lives here through Chicago. Really excited about what we can do together and better integrating the Department of Public Health into the larger portfolio of Cook County Health. I think there's a lot of opportunities there, a lot of upside there. Communication was mentioned, and over communication regarding COVID and other things that are going to be public health priorities. So I look forward to that. And then lastly, I want to certainly thank the interim leadership, Drs. Rubin and Joshi, who have been rapidly trying to get me up to speed. I think I asked them to join me in this first round of meetings, and then they'll be falling back in leading their other respective units and responsibilities as I move into the leadership. So with that, I just want to say I look forward to meeting with each of you. I will be reaching out to you. I have already started with some of you all. I look forward to our one-on-one, sitting down and kind of picking your brain on the opportunities that you see going forward. And thank you, Mr. Rocha, for finding me in Saudi Arabia, you and your team, and bringing me back home.
Thank you, Doctor.
Welcome.
Yeah, thank you, Israel.
Well,
Welcome.
you got a couple hands up.
Oh,
Mr. Chair, you got a couple hands up.
I'm trying to get there. Trying to get there.
Got it.
Thank you. Commissioner Deere, I see your hands up, and then we'll go to Director Harrington.
Thanks so much. I just want to say a welcome to, another welcome to Dr. Hasbrook. I am looking forward to working with you, excited about your appointment, excited about you coming on, excited about your track record and the work that you have done, and excited about your future here at Cook County Health. So looking forward to working with you.
Thank you.
Thank you, Vice Chair Deere. Director Harrington. Did we lose Director Harrington?
I'm excited to see Dr. Hasbrook back in Illinois. I was his regional health officer when he was the director of the Illinois Department of Public Health. So we have a prior relationship. So I guess in the interest of full disclosure, I'll let you know that. And we have communicated since his name came up and since he was appointed. I look forward to working with him. Also, while we were having discussion about COVID and information, I took the liberty to take a quick look at the Cook County Department of Public Health's website and saw that it was a wealth of information there, and want to commend what's been done, and that's under the leadership of Dr. Joshi and Dr. Rubin and that team. But some of the questions that were raised may be addressed, and the exciting thing is they have direct links to the CDC webs page to address some of the questions. So people may want to take a look at what we're already doing and feel proud of the job that's being done. Thank you.
Thank you. Appreciate it. See if we have any other hands. Vice Chair Deere, your hand is still up, raised. Do you have additional comments?
No, I'm sorry, I forgot to lower it. My
No
apologies.
worries. No worries. Well, Dr. Hasbrook, as you can see, we all look forward to working with you and like to welcome you again.
Thank you.
Israel, thank you very much for the thorough report. I also like to acknowledge that Director Kim has joined us and is present. Next on the agenda are the board and committee reports. The minutes for the May 27th board meeting are being presented for your approval. Approval will take place in a combined motion later in the meeting. Are there any corrections or revisions needed to be made to the minutes? Hearing none, we will proceed. Director Prendergrass will review the HR committee metrics with Valerie Amos, Chief Human Resources Officer. The committee did not meet this month, so the metrics are being presented directly to the board.
Thank you so much, Chair Taylor. Good morning, everyone. And as Chair Taylor has mentioned, the Human Resources Committee did not meet this month. Our next meeting is scheduled for Thursday, August 18th at 12 noon. I'm going to now turn it over to our Chief Human Resources Officer, Ms. Valerie Amos, to present the metrics for today. No motion is needed, and these are being presented for informational purposes only. So thank you, and Ms. Amos, you can take it from here. Thank you.
Thank you. Good morning, everyone. Just to start off with some information, I think it's really, sorry, Valerie Amos, Chief Human Resources Officer. So just wanted to really share some market research. I know that there's been a lot of information in the press. We've heard testimonies in the past, and just wanted to provide some really concrete, relevant information that's more contemporary. In terms of the industry insights and benchmark performances, here's some emerging trends. So the U.S. is projected to experience a shortage of RNs. Really, that's intensified as the baby boomers age and the need for healthcare grows. So compounding the problem is the fact that nursing schools across the country are really struggling to expand capacity to meet the rising demand for care. The American Association of Colleges of Nursing, AACN, is working with schools, policymakers, nursing organizations, and the media to really bring attention to this healthcare concern. AACN is also leveraging its resources to shape legislation, identify strategies, and really form collaborations to address the shortage. So we're projected, again, 1 million nurses will leave the workforce by 2030. The average turnover, as you see, is at an all-time high of nearly 26%. We also see that 2 to 3 times the nursing premiums as it relates to travel nursing, i.e. agency, really increased during this time. And of course, 4 to 4.5 million workers were impacted by the Great Resignation. Healthcare was number 3 out of the job titles as it relates to the Great Resignation. And for those of you, just to catch you up on that, that's really a mass exodus of a number of employees during the pandemic crisis. We are now kind of seeing a great reshuffling. We'll see that in the terminology today, really where individuals are not necessarily resigning, but they are leaving and they're going to other organizations. So we need to really play close attention to that as well. As I mentioned, the nursing schools are struggling. So we're going to see about 80,000 nursing applicants turned away due to nursing school issues. So insufficient faculty, clinical site issues, budgetary issues, and then of course, 85% we see in the market of individuals that were surveyed really indicated that they are doing more work in terms of 2 to 3 times more work in terms of their productivity. They're looking for information, they're duplicating efforts. So less people in the market, more work equals quite a bit of consternation and sometimes some turnover issues. So $24 billion, we see that in the market as well. A lot of hospitals were impacted due to staffing shortages. And then, of course, some of the top reasons for leaving, as you've heard in the media and as you've seen in previous reports, but just wanted to keep it at top of mind. Some folks left early. They accepted retirement packages. Some were really burned out and had pandemic fatigue. Some went to work with the agency, those lucrative agency offers. And then, of course, went to competitors for higher wages. So this information, there are footnotes at the bottom, but most importantly, some of this information came from over 3,000 hospitals that were surveyed across the country, and they participated in this comprehensive survey. So really good information about turnover, retention initiatives, vacancy rates, recruitment metrics, and staffing strategies. Next slide, please. So this slide really is a very familiar slide to most of you. Our average number of monthly hires has been about 43, and we're taking actionable steps to really substantially drive that number to the hundreds per month. So our internal movement is also critical to capture and remains a driver for career mobility. So we ended the month of May with a total of 263 hires. 149 of those were external. 70 of those, I want to note, were promotions. So that's almost a third. So that's huge for our organization in terms of retention. And then the rest, which is 17%, were transfers. Next slide, please. This slide is really a compilation of some of the activity. Typically, this is what we call the summary of the waterfall slide. And I know that these are only numbers, but just to tell the story of what's happening, over 1,900 positions have been touched by the HR team. So that's a huge number. And what does that really mean? We posted over 1,800, and postings closed, mean that they were posted and closed, and the team has worked on over 1,000 of them. So that's combing through all of the necessary background experiences of the candidates to ensure that they kind of meet the minimum qualifications to move them and progress them through the recruitment process. So over 700 were referred for interviews. Over 500 were completed in terms of the interview process. There were a number of offers, and as you can see, vacancies filled equated to 263. So some of those offers, I will note, some of those offers, candidates will say, I need a little bit more time to think it over. And sometimes they have competing offers as well. And it does take some time for us to receive that information back. But I'm happy to share kind of a tracker towards the end of the presentation that will really start to bridge that gap while we wait on candidates to really finalize their communication back to us. We're still going to be tracking this in real time. And at the board reports, I'm going to start kind of shifting towards that metric so that you can see more real-time data, because this is definitely lagging. Director Ketting, I think I see a hand.
Yeah, so roughly speaking, we have to, at least at the moment, we have to offer, um, make 2 offers for every position. Not quite, but pretty close.
Not necessarily. We are pretty close to that, but we still have to dig into our data to really tell the story. And what I was going to share towards the end is that we are capturing declinations. We were not capturing that in our system before. We captured it in email. So now we're going to aggregate that data and really drive into the details so that we can start tracking and trending what is really happening. Because to your point, if we're extending to 2 candidates before one accepts, then we're always going to be behind the 8 ball, and we need to kind of move that up.
Yeah,
But it's a good
I mean,
observation.
it's become sort of the problem the airlines have with, so we need to start overbooking. You know, if it's even if it winds up being that we only get 2 out of 3, we offer a position, that
Mhm.
we need to just build that in. You're on top of the trajectory. Problematic.
Yeah, and I agree with you. That means we need to really attract more candidates who are qualified for the positions. We do see quite a number of applications. We just need to distill those to the most qualified for our positions because we don't want to compromise on safety and quality and just hire a warm body. So we are quite selective as well, and we're working to drive that velocity to that throughput and speed as well that we have struggled with in the past. Director Curry, I think I see your hand. Is there another question?
I think that's Director Harrington.
Oh, Director Harrington, I apologize. I can't see
No
well.
problem. Yeah, I just want to make an observation, and this is probably a good point, a good time to do it. One of the things that I think is really a concern moving forward is how COVID has impacted some of the dynamics related to healthcare on 2 ends, most specifically. One is how and when patients actually access care, because the initial messaging around COVID was not to come to the hospital because hospitals were overwhelmed. And I don't know if we've recovered from that because it's sort of impacted people's ideas about when and how to seek care. And some of the numbers that we've seen sort of demonstrate that. And the other thing has been the impact upon staffing in hospitals. And the data that you presented really show how difficult it is actually to hire staff. I looked at the percentage and of the vacancies that were available, we only filled 14%. And so that means we still have a lot of unfilled positions and it's a real challenge. I say that because we recently released a plan. And when you do a SWOT analysis, one of the last things you talk about is threats. And we have 2 major threats, I think, moving forward. And we need to keep these in mind as we continue to plan, as we continue to strategize about the future in terms of patients and how patients will and when, how patients will access and when they will access healthcare. And that might change some of our dynamics moving forward. And then the other thing is this major issue of staffing. And it's not just nurses, it's doctors, it's other staff in hospitals and healthcare that are burned out and are seeking other opportunities.
No, and I agree with you. Those are really good points. And it's, great to hear that there's such an awareness of what is happening. We don't want to just be the victim though. That's why we are taking actionable steps to really be methodical. And I know you spoke about the SWOT analysis. That was also completed when I started and shared that with Mr. Rocha, who really, was the biggest champion for change. And that's why we have so many external partners assisting us with identifying some streamlined processes as it relates to recruiting, because what we were doing was also a little archaic with the times. And so being contemporary, moving towards contemporary recruitment practices will serve us well. With anything, it takes time. And so I know we don't have the luxury of a lot of time, but we are definitely striving to achieve. And so I'll move to the next slide so that we can talk about some of the things in a little bit. Just to finish out the metrics, as you mentioned, 14% were hired. We still have a situation where those total separations are exceeding our number of new hires. And so we have a variety of important jobs that have exited the organization for various reasons. As you can see, the number of resignations at this moment, 265, really kind of lead the pack as it relates to our retirements, discharges, and so forth. So the net loss, I mean, we have lost essentially, 250 folks based on our number of hires. So retention is the focus in addition to recruiting. Next slide, please. So as you've seen, this is kind of our hallmark slide. It really kind of speaks to what we plan and how we are progressing. You'll see the slide probably in every meeting because I want you to stay focused on here are 4 cardinal topics. So resources, as we talked about, staffing is critical, and then recruiting, making certain that we have the right processes, the throughput, technology solutions. We also have to have scalable and modernized solutions to start tracking, trending our recruitment metrics, understanding how we do measure up so that we have that baseline and benchmark. And then, of course, retention, as I mentioned before, is a cardinal hallmark for our organization as well. Next slide, please. So what are some of our accelerators and why is this slide so important? Really, the accelerators are our drivers of change, and we understand that the market conditions, as you just mentioned, Director Harrington, that the market really has shifted based on COVID and a number of situations as it related to folks coming to the hospitals and so forth. However, this slide really depicts some actionable items. So what does it indicate? Here's some key initiatives or accelerators or drivers for us. These are some concrete steps that we have taken, and we've partnered with those external vendors that many of you have heard about to really help us with the HR optimization, which again is basically streamlining recruiting processes, identifying those accelerators to really assist us with recruiting faster and identifying ways to track and trend those recruitment analytics that I mentioned. So Slalom, as you know, has been really responsible for helping us build out operational and technical resources to really allow our team to work efficiently and effectively. They have been assisting us with daily hiring meetings. So it's important for us to keep our foot on the accelerator and really hold those meetings. So we meet about 15 minutes, 20 minutes on a daily basis so that we can identify those offers. We call them decision to hires in our space. But most importantly, we were able to really track and trend this starting May 16th. And I'll show you on the next slide a dashboard of what that looks like so that it's more real-time data. But most importantly, our goal is to target extending those offers once we receive the offer recommendation no later than 72 hours. In the past, we have had a number of delays, and so we're working on that efficiency standpoint. And as you know, the number of delays has had to do with our bandwidth within the department. So those daily stand-up meetings, we're focusing on delivering results and certainly identifying blockers or any obstacles that may be in our way. So getting those offers out faster, really working with the recruitment team. All of the recruiters are on the call, as well as the talent acquisition leadership and myself. And of course, Slalom is supporting us through this so that we can track and trend. Another way that we are driving change is accelerating support through an outside company called Incredible Health. We started working with them and launched our implementation June 13th. Incredible Health, as you know, is kind of a data repository of nurses. They are a company that identifies and matches nursing candidates to our available positions. So we started with our Provident positions because we know we need to revitalize and uplift Provident because there's a number of initiatives that are driving change there. And then, of course, Stroger in our clinics. And so in terms of priorities, they have been assisting us with sending really qualified candidates our way, and we have a very nice project plan where we partner with our nursing colleagues under the leadership of Dr. Bina Peters so that we can drive change there. So this particular company is assisting us with nursing candidates. In addition, we have the virtual job fairs through Brazen Technology. This is, again, this Brazen Technology is really a virtual platform so that we can host job fairs, interviewing blitzes, and also speak with colleges and universities. We have started to build out our campus recruiting. I shared a little bit of this with some of you on a previous week, but most importantly, we need to be out in the community. And if we can't physically be there, attending career days and graduations and those on-site job fairs, then we need to be there virtually. And so this particular technology solution will enable us to do that. And in terms of interviewing blitzes and scheduling, we've also identified a number of departments that have candidate information within their department. And so we'd like to encourage them and work with them and started tracking and trending the number of blitzes and the outcomes of those blitzes. We've had some of this before, but we didn't track it as well. Now that we have a metrics dashboard that I'm going to show you next, we'll have the ability to start tracking and trending. And then most importantly, once we start to see the increased volume, we will certainly look at increasing the number of employee orientation sessions so that we are scalable with our approach. Next slide, please. So as I mentioned before, I think I see a hand. Director Curry.
Thank you. This is Director Curry. Thanks. Ms. Evans, I just had a question on the previous slide. And if you mentioned a number specifically on the virtual job fair, so this is the first week that this was implemented. How did we look this first week? Did we get out the gate pretty strong, or there's still some ramping up that needs to be done?
So a really good question. There's ramping up that needs to be done. We have identified how to kind of market this particular event, and I have a couple of slides in the appendix that I may obviously show you, but this is a new platform for our organization, so we are ramping up. Great question. Any other questions? All right, next slide, please. So in terms of our key metrics, I showed you the kind of lagging metrics, if you will, but here's an opportunity. I mentioned before at one of the previous meetings that we have now launched in pilot stage a metrics dashboard, something that we can track and trend on a daily basis. So here's a summary slide of a lot of data behind the scenes. So in partnership with our business intelligence team, our HIS team, we have launched this. So in essence, 121 individuals accepted offers since May 16th. Again, the line in the sand when we started to really track and trend in this method was May 16th. So I'm using a different date from the previous slide, and I don't want to confuse folks, but I just wanted to, again, share that we are progressing in a different manner. So May 16, 121 folks accepted offers. We have the external versus internal listed below, as well as the number of, or the job titles. So as you can see, 49 folks who are nursing folks. We have 4 physicians and so forth. The next particular box to the right represents folks who started. And in the metrics report, I only have been sharing data of individuals who started. And that's because those are real kind of folks in seats, we want to make certain that that's clear. However, it's really promising to see that folks are accepting our offers, and we are starting to track towards a big audacious goal of 400 hires by September 1st. So as you can see the thermometer up top, 57 of those were external by by June 10th, when I shared these slides with Deb Santana for your view. We have since moved that needle though, and I'm excited, to share that. In addition, the bottom left, looking ahead, who's still waiting on offers, we had 46 folks to come through, which is fabulous. Then the team at our daily huddles can identify again any blockers. Anything that will slow us down, we'd like to huddle together, divide and conquer so that we can extend those offers out within 72 hours. Folks who had declined us, we started to track a little bit of data a little earlier than May 16th. And so we've been looking at reasons why folks have declined us. So pay is one of the declinations. Some folks remained in their current job and others just did not share with us. So again, this is a really busy slide, but I wanted to share as a daily kind of metrics dashboard. We have shown some visibility for hiring managers to see where they are with the recruiting process. We want to be more transparent. This is one of kind of our evolving trends in terms of tracking and having some good talent analytics. So I see some hands.
Thanks so much. This is really great. This is Director Prendergast. I have a question. So I know that our overall goal is 400 by September 1. Do we have monthly goals established so that, our, if so, can you share what those would be?
Well, September 1 is of course right around the corner. So our goal was to hire at least 100 by May. However, we didn't reach that goal. So we are fastly approaching, and we'll need to hire, as I mentioned before, hundreds in order to achieve that goal. And why is that such a critical number? We need to catch up and really kind of really help our retention focus, if you will. We need to get on top of that. There are a lot of strategies also in place for retention. I shared a number of the recognition kind of strategies before at the previous meeting, but you're right, Director Prendergast. We have a huge opportunity here, and so in order for us to make that, we need to have at least a couple of hundred hires in the next couple of months, because we understand that everyone will not accept our offer. As attractive as Cook County Health is, people still do have choices, and we are competing against a really tight market. Director,
Thank you.
no problem. Director Curry. Is there a question, Director Curry?
I think that might have been a no. He just left his hand up. But it looks like Director Harrington has a question or comment.
Chair Taylor, I believe it's Dr. Hasbrook that has his hand raised.
Dr. Hasbrook?
Hi, Valerie. Thank you. Excellent presentation. I'm not sure if I'm allowed to ask questions or I'm more of a kind of a participant observer. So I just shot my hand up, but I'm curious in terms of what we've done in the way of salary surveys to find out kind of where we fall in the percentile of salaries and how that relates to our competitiveness with regard to recruitment of various job titles.
That's a really good question, and I appreciate it. We understand that there are some high, steep competition in the market, and what you didn't see, Dr. Hasbrook, is kind of a presentation that I shared with others prior to you starting. But most importantly, it spoke to our Chicagoland competition and how some of those particular organizations also had a number of incentives, and some had higher wages, as well as a number of other recruitment and retention strategies. So we are poised to conduct some pay parity, and we're going to be looking at our comp analysis as it relates to our overall need within the organizations. We do have some pockets that we need to start with first, so we have some priorities, but we have some RFP plans to conduct that full analysis. It's going to be imperative for us to be as competitive as possible. Our benefits have been rich in the past, and I think that that also helps us, but it's not the end all and be all. So to your point, that needs to happen, and we have plans to conduct those analyses.
Thank you.
All right. Next slide will probably be just questions and thank you, but in the appendix, Deb, if you can scroll through. So here's just an example of the Brazen online platform. It's not just simply a Microsoft Teams event or Zoom or WebEx. Here's an opportunity for us to brand this and showcase Cook County Health. We have breakout rooms for individuals to have those in-person, virtual in-person interviews. And so it's a modern approach, and it really provides a nice applicant experience. So I think Director Curry, you had inquired, this has been a thoughtful process so that we can ensure that we have the necessary capability to really launch this well. We also have the video capability to send messages out. So it's a little different. It's almost like an in-house job fair, but it's virtual. So we're pretty excited about that, because to host an on-site fair requires about 30 people, and we'd like to do this at a scalable time frame, and more flexibility, I think, will allow us to conduct more job fairs on a monthly basis. The next slide also depicts, the next slide also just shares a little bit about the mobile capability as well. And there's transcripts that can also be there. And then, of course, we can have monitoring by our EPO team as well. So just really kind of moving towards more contemporary practices as it relates to interviewing and really speeding up our process. That's all I have for today. Thank you.
Any questions for Ms. Amos? Well, thank you so much for an excellent presentation as always. And I will turn it back over to Chair Taylor. Thank you.
Thank you very much, Ms. Amos and Director Prendergast. Next, we will have the Managed Care Committee metrics reviewed with Aaron Galiner, Interim CEO of Health Plan Services. The committee did not meet this month, so the metrics are being presented directly to the board. There are no action items or no motion needed today. The date of the next meeting will be July 22nd at 10:30 a.m. Over to you, Mr. Galiner.
Thank you, Chair. Good morning, Directors. Aaron Galiner, Interim CEO with Health Plan Services. Starting on slide 3 with our membership this morning. Overall membership has increased above the 435,000 member threshold, so at 436,000 as of June. On the next slide, you can see our overall market share data. This data is through March from the state. We're at 32.5%, so we're continuing to increase towards that 33% mark, which I suspect we're pretty close to once the state publishes data through June at this point. In terms of our trends versus the overall Cook County Medicaid market, you can see on the right, the overall market versus the graph on the left, which is our specific county care data. So the market overall is up about 8%, or excuse me, about 5% over the past 12 months versus county care's increase in membership of about 8%. In terms of our membership versus budget, as you know, we're continuing to exceed our budget by a significant margin, driven by the redetermination and 50% auto assignment. In terms of our operations metrics, we're continuing to perform here well within our SLAs, so no real call outs here other than we're continuing to see pretty steady performance. In terms of our inpatient admissions per 1,000, we're continuing to see year-over-year improvements. So red bars are the prior period, the blue, dark blue is actual claims data we've received, and then the light blue shading is projected utilization based on IBNR factors with our actuaries as well as our authorization data. In terms of vaccination rates, we're around 56 to 57% as of today. This data is a couple weeks old, but we've seen this continue to increase, although at a much more moderated pace than we had been seeing over the past few months. And then the last two slides are our claims payment timeliness metrics. You can see that we're right around the 30-day mark. And on slide 11, you can really see the aging categories for this. So you can see the significant progress we're continuing with our aging categories. So less than $11 million right now is over 30 days, which is pretty substantial progress from where we were 18 months ago. So we're continuing to push improvement on this and are happy with progress there. With that, I'm happy to take any questions.
Looks like Director Story, you have a question.
Thank you, Mr. Chairman. Aaron, good morning once again. I have a couple of questions. The first one is, can you just update the board on the state's position on redetermination, please?
Yeah, thank you for that question, Director Story. So currently, we are expecting the public health emergency to continue through at least October. CMS is supposed to provide at least 60 days notice before the end of the public health emergency period. So we have not received any notice to date. So once the public health emergency ends, we would expect the redetermination process to start within 60 days of that point. So at this point, we're really in a phase of waiting for guidance. And during this time, we're really working to work with the state to ensure members have updated demographic information in the state system so that they get all of the redetermination forms once that process starts.
Aaron, would you please remind me and the board about your budget for this fiscal year? Did we anticipate that we would have this extended redetermination, or did you budget lower for fiscal year 22? A lower number?
Yeah, so for fiscal year 22, we assumed, and again, this was a budget set back in August of 2021. We assumed redetermination would begin as early as January 1st of 2022. So we're about 9 months, we're looking at being about 9 months past that original assumption.
So thank you. So that's good news for county care and Cook County Health.
Absolutely.
Can you comment on where we are with respect to any significant changes with regards to domestic spend in our book of business?
Yeah, so I think, and certainly we can talk about this in Finance Committee in the future as well. So we've seen pretty I'd say stable utilization of domestic facilities. We do have I think a good work group going internally right now with a number of different initiatives to try to increase that utilization through a number of different avenues. As our empanelment continues to grow with Cook County Health physicians, we're really working closely with the ambulatory team on getting those members into care and into see their PCPs, which will help, pull a lot of the downstream specialty and eventually surgery and inpatient stays from that as well. So there's a number of different initiatives going on around ways we can partner with the health system around domestic spend, and I'm happy to take some time at a future meeting to go through those more in depth as well.
Thank you, Aaron. I would appreciate that, and I trust that other board members would also appreciate that. One last question, Aaron. What is the status of our More Care?
Yeah, so we're right now working through the transition process. As you know, that plan is scheduled to, or our involvement with that, with the More Care product is scheduled to end at the end of December. So we are working mainly through transition planning right now for that, for the end of that product. So, that works ongoing and continuing to, I think, proceed pretty well in terms of transition process.
Aaron, thank you very much. I appreciate that. Thank you, Mr. Chairman. That was my last question.
Thank you. Directors, are there any other questions? Thank you very much, Aaron. Appreciate you joining us in the update.
Thank you.
Next, Director Ketting will now review the Audit and Compliance Committee meeting minutes. Director Ketting.
Yes. Morning. The Audit and Compliance Committee met on Friday, June 17th at 8:30. The next meeting of the committee will be Friday, July 22nd at 9 a.m. The major thing that happened at that meeting was the report from the auditor about our annual audit, and we will return to that in the closed session. At the open session, however, Nicole Almiro, who's the Chief Corporate Compliance and Privacy Officer, provided an overview of metrics that showed that business was proceeding as usual. The committee did go into closed session to receive the report from the audit commission, from the audit team, but there were no actions at that, so we won't need to return. And in the combined motion for today, we will include the minutes of the audit committee. So that should take us until we get to the closed session.
Thank you very much. Do you have any questions? Do not. Next, Director Garza will now review the Quality and Patient Safety Committee meeting minutes. Director Garza.
Yes, thank you, Mr. Chair. The Quality and Patient Safety Committee met on Friday, June 17th at 11 a.m. We are not planning to have any re-review of the metrics and presentations from the meeting, but if any additional questions are raised, staff will be present and ready to address those questions. The next meeting of the committee is Thursday, July 21st at 10:30 a.m. The committee received the following reports, which are included in the minutes. Let me just say my own experience in this meeting, that there is a lot of good work being done by the staff, really enhancing the quality experience for our patients in the county system. So I just wanted to outline that. So what was reviewed was the 30-day readmission rate for Stroger Hospital, the case mix index, along with the medical and surgical MS-DRG for Stroger Hospital. The top box score, recommend the hospital, Stroger Hospital, and the HbA1c, 9%, greater than 9% was also reviewed. Also received regulatory and accreditation update, which is also included in the minutes. Received an update from the HRO clinical documentation work group, also included in the minutes, and then received the nursing operations update, also included. Received the EMS and MEC reports. The Stroger Hospital and Provident Hospital medical staff action items were presented for the committee's consideration. And the quality committee summaries from Stroger and Provident Hospital were presented for informational purposes. Dr. Ankantoran presented and reviewed the Stroger matters, and Dr. Luffman presented and reviewed the Provident matters. The committee approved the following action items, which are included in the minutes. Approved the Stroger and Provident medical staff appointments and reappointments and changes. The committee did go into closed session, but there are no plans to re-review that information today. So the minutes are being presented for the board's consideration as part of the combined motion to be made later in this meeting. And once again, if you didn't have a chance to get into those minutes to see the great work that's being done, I encourage you to do so. That concludes my report, Mr. Chair.
Thank you, Director Garza. I concur that there is great work being done. And again, for the directors who couldn't attend the meeting, I would ask you to make sure you review the minutes in detail. Next, Director Ryder will review the Finance Committee meeting minutes.
Yes, thank you, Mr. Chairman. The Finance Committee met on Friday, June 17th at 9:30 a.m. The next meeting of the committee will be held on Thursday, July 21st at 9 a.m. We're not planning to have our staff re-review reports and contracts from the meeting, but I believe for those of you who could see Deb's screen, she'll be putting that up. She'll be putting that up on the meeting. The committee considered the following action items, which are included in the minutes. Conditionally approved 18 contracts and procurement items. Number 6, 7, 14, 15, 16, 17, 18 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. We also received and filed grant award related items. The committee received the following reports, which are included in the minutes. Minority and women-owned business enterprises reports, the quality report of contracts executed under the authority of the CEO. 2 emergency purchases were reported, a report of the April 2022 year-to-date financials. The action items, reports, and presentations from the committee meeting are included in the meeting minutes. If there are no other questions on the information, the minutes are being presented for the board's consideration as part of the combined motion to be made later in the meeting. If there are no other questions, that will conclude my report.
Thank you, Dr. Ryder. I thought I saw a hand up, but maybe not. Director Story, your hand is up. Is that from previous?
Yes, sir. I apologize. I'll remove it.
No worries. No worries.
Thank you, Mr. Chairman.
Thank you. Again, there are no contracts being presented directly for the board's consideration. So if there are no other questions on the minutes and action items contained within the minutes, we can move on to the combined motion. Hearing no questions, I'd like to entertain the following combined motion to approve the following. Item 4A, May 27th board meeting minutes. Item 4D, June 17th audit and compliance committee meeting minutes. Item 4E, June 17th minutes of the quality and patient safety committee meeting, which include the Stroger and Provident Hospital staff, medical staff appointments, reappointments, and changes. And item 4F, the June 17th meeting minutes of the finance committee meeting, which include the contracts and procurement items and grant award related items. Do I have a motion?
So
So
moved,
moved, Mr. Chairman.
Director Harrington.
Second, Director Story.
Thank you. The combined motion has been made and seconded. Madam Secretary, please take the roll call vote on the combined motion.
Roll call vote on the combined motion. Aye or nay, Director Curry?
Aye.
Vice Chair Deere?
Deere is aye.
Director Garza?
Aye.
Director Guggenheim?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Keding?
Aye.
Director Munar is absent. Director Prendergast? Director Prendergast? She may have stepped away. Director Prendergast? Okay. Director Ryder?
Aye.
Director Story?
Aye.
And Chair Taylor?
Aye.
And I'm going to circle back one more time, double check, make sure that Director Prendergast, are you present? Okay, so you have 10 yays and 2 absent.
Thank you. The ayes have it. The combined motion carries. We have already received the report from the CEO earlier in the meeting, so the board will now be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. I'd like to entertain a motion to go into a closed meeting pursuant to the following exceptions to the Open Meetings Act 5 ILCS 120/2C 1, 2, 11, 12, 17, and 29. Do I have a motion?
So moved.
So moved.
You have a second?
Second.
Thank you. The motion has been made and seconded. Madam Secretary, please take a roll call vote on the motion.
Roll call vote on the motion to go into closed session. Director Curry, aye or nay?
Aye.
Vice Chair Deere?
Aye.
Director Garza?
Aye.
Director Guggenheim?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Keding?
Aye.
Director Munar is absent. Director Prendergast?
Aye.
Director Ryder? Director Ryder? Oh, he stepped away. Director Story?
Aye.
And Chair Taylor?
Aye.
Chair Taylor, you have 10 yays and 2 absent.
Thank you. The ayes have it. The motion carries. We will now disconnect and go into the closed session. Thank you.